All right, everybody, welcome back to a Buffalo Brief. I've got a great guest coming up next for you. This is a story that's one that we have covered many, many times over the years, and it becomes increasingly important. Of course, we're going to talk about addiction and addiction services across Western New York, and specifically in Erie County. We're going to talk about something called the Matters Network and what that is and the people behind that. That leads us to our guest today. You may have seen him on our air before because he's been on many times, but he is also out in the community on the medical side. This is Dr. Joshua Lynch. Dr. Lynch, thanks for being here.
Doctor, thank you so much. Your background, with UBMD, you are a physician with Kaleida Health, and you are the Mercy Flight Medical Director. So thank you for everything. Thank you for taking the time to be here with us in between all of that as well.
Absolutely.
Okay, so you were being honored by Johns Hopkins, but before we get to that, explain what Matters is. You started this years ago. It is now a multi-state network, not just here in Buffalo, but it started here in Buffalo. How does it help those with substance abuse?
Yeah, so Matters was formed now almost 10 years ago, right in Buffalo, in partnership with multiple hospital organizations, with UBMD Emergency Medicine and the medical school. And really, we sought out to help patients overcome obstacles when trying to get linked and stay in treatment for opiate use disorder. And that has evolved a lot over the last many years. Now we add a layer of telemedicine to kind of act as a safety net to help people get linked up with treatment. We offer harm reduction supplies. We manage a network of harm reduction vending machines all across New York State that have Narcan in them and other things. And then also follow up with patients for several months to make sure that they're still doing well and they don't need, and find out what else they need. They usually always need something, and we want to be there for them along the way.
I feel like I met you when there was kind of the peak frustration. This was kind of after or just in the wake of Erie County. The numbers of overdose deaths were soaring in the 300s, 400s, like at one point, just people dropping dead day after day. And I remember the efforts that you were going through, and you and other local leaders, especially on the medical side, trying to figure out how can we attack this problem, because people are still dying every day. And it is sort of that approach, that frustration, getting your arms around the problem and taking those steps. Do you think that is what sort of impressed the folks at Johns Hopkins? The reason that Matters existed and the success that it's seen thus far?
Yeah, I think that that's certainly a part of it. The other part is that we built Matters to be applicable in any geography. So it doesn't need, there are other models that had come out of Yale and other Ivory institutions, and not everybody's like that.
Right.
And actually, most of the country isn't like an Ivy League school with networks of clinics and follow-up and redundancy and all that stuff. And, Buffalo's certainly not like that. And, places like the rural southern tier of New York are certainly not like that. So we really wanted to take a step back, think about what's the most important. And the most important is always the patient. And we let the patient's voice determine how we build this, what works for them, and more importantly, what doesn't.
You were in the ER, you were noticing people coming in, and you were noticing as a doctor, you couldn't really do much to help them. When somebody calls the number that we can put up on the screen now, and includes Matters in that phone number, can you just walk us through exactly what Matters does to help that person in need, and a lot of times the family as well?
Yeah, so I think one of the most important resources that we're fortunate enough to have here in Western New York is a partnership that results in a 24-hour addiction access hotline. And what that does is allows you to, anywhere in the 8 counties of Western New York, get access to a provider that can do an assessment, potentially give a prescription if appropriate, and then most importantly, link you to treatment at a place that you pick. Not a place that you're forced to go to, or you're not given options with appointments weeks out. So that is available 24 hours a day, and that no kidding gets you access to someone who can do an evaluation from the comfort and privacy of your own home or your friend's apartment or wherever, and then evaluate you for a prescription for treatment for opiate use disorder, and then linkage to treatment.
It's amazing. And that number is on your screen, 765-MATTERS, 765-628-8377.
Just incredible strides that have been made. And whether it's Matters, whether it's just sort of the cyclical nature of addiction in community-wide basis, I guess, if you will, those numbers have gone down. I mean, do you feel like this has, and certainly we'll talk about it in just a second, John Hopkins certainly feels like you have contributed to solving this problem, but the numbers have gone down pretty dramatically. We've seen spikes here and there, but do you feel like what you're doing and what your team is doing is helping?
I mean, that's certainly the goal. And we continue to remain nimble so that as the opiate epidemic evolves and other substances kind of come and go, that we're ready to be able to help people get linkage and get resources for those other problems too. And one of the goals for early 2026 would be to help facilitate linkage to treatment for other substance use disorders, along with other challenging diagnoses such as mental health diseases, HIV, hepatitis, all the things that are people might be reluctant to seek care for and also might have trouble navigating the system.
Johns Hopkins, one of the top medical institutes across the entire country, potentially the entire world, chose Matters and You for the Innovations for Substance Use Disorders program this fall. What is that, and how is this going to help you expand this incredible program that you have?
Yeah, this is really an incredible honor to be included in the cohort of this program of 30 people from all over the country. This is a NIH funded program that brings in innovators in the field of substance use, and it doesn't necessarily need to be delivering care per se. There are also people that are developing therapeutics, developing medical devices, and it puts you in the circle of faculty of the Carey School of Business at Johns Hopkins, but also experts that are in the field of intellectual protection to walk you through what patents mean and copyright and trademark and all those things. Wow. But and other folks that have led startups in this space and then transitioned off to other ventures, but really kind of giving education on the things that you don't learn in medical school, that you don't learn as a practicing physician, a great piece of groups like this is learning from the other people in the room that are either from academic institutions or from private industry or from government, and bouncing out ideas off each other, being facilitated by these world-class faculty of the university it's just incredible.
I mean, the cream rises to the top, I imagine, anyway, and in a room like that full of innovators all kind of going to the same direction with the same goal. What did you learn already when you went? What was that for? I saw you text me some video of a presentation you had given. So how was that, and how were you received?
Yeah, it was great. There were groups of people that kind of came together. I was there by myself, and really was pitching the Matters model and a lot of the different things that we do, and so luckily there weren't a lot of other people doing this type of work, which was great for me because I got to learn about other things that they're doing. And, we shared a lot of ideas around artificial intelligence and how that can help scour medical records to see patients that could fall through the cracks that aren't linked up after an ER visit, which we know happens all the time. And other kind of drug detection devices, ways to prevent overdoses that are really novel and not really anything that we've kind of talked about mainstream yet. So, bouncing ideas off like that, and then also learning how skills to bring home to kind of leverage AI in trying to find patients and identify patients that are about to fall through the cracks or that might start using again. It might be at higher risk. I plan on running right down to the AI Institute at UB and
how can we work together?
Meeting with them exactly and learning about what they're doing. And I think one of the key points I learned was we still work in silos often, even though the collaboration is kind of the key to this. And just reminding ourselves that we're blessed in Western New York and in Buffalo to have such great minds and leaders, and having UB right in town is an incredible resource for kind of all things addiction and way beyond.
How long was the program?
So it runs for about 3 months, and that includes a week in person, which was which was in October, at their campus in Baltimore, right on the water.
And then beautiful setting, I imagine too.
Yes.
And then the idea is that when this is it a course? Is that fair to say? When it's over, you will have something practical plus the potential for this competition. But the idea is that either whether you win or not, each of these participants will come away with something practical that they can deploy in their communities. How does that work?
Yeah. So, you go through the curriculum, which is hybrid, obviously in person and virtual. The whole point is that you've taken your idea and been able to make it more sophisticated, learn from others. And in past groups, people have kind of like paired up or grouped up and have gone into an innovation together.
Wow.
And then, it's kind of interesting, like the program itself would be great, just that. But the fact that it kind of ends with a pitch competition, we have pitch competitions in town here. Yeah. The one just wrapped up this fall. So, being part of that as a physician is very unusual, very awkward, and kind of an unusual opportunity that presents itself. So, learning from each other in a room for a week and then knowing that you're competing against the same people that you're partnering with, 6 weeks later is really, really interesting. So,
all right. What are you competing for after, you did that big pitch? What is at stake there?
So I believe the winner of the pitch competition gets $10,000 to kind of further expand their idea. So that would be great. We did some practice pitches at the end of the in-person week. I volunteered to do that.
Oh, so that was just a practice pitch.
Yep.
Sorry.
Yeah, it was a practice one. The real one is in December.
Got it.
The practice one was very humbling, but also it was really fortunate to be able to get feedback from these industry leaders that are faculty, at Johns Hopkins Business School, and it was pretty awesome.
You always talk about how, and you are a very humble guy, so don't let me misconstrue this in any way. But you always talk about how nervous you get and things like that. But every time you're on our air, you always do an excellent job because I think you're such an expert at your field. And you broaden your field. Like you're not just an emergency room physician. You've taken that and brought it out into these other things, and you've created other positions for yourself. So I feel like you're in a good spot to deliver a speech to a bunch of people who want to listen about this innovation of this project. But that $10,000 is kind of ancillary. It's the idea that you just got that you're going to go down to UB and maybe see what kind of AI help they can. How will you put that into practical knowledge? Because going down there and having lunch or coffee with somebody at the AI Institute is one thing. Taking that and moving it into your program, that's another.
Yeah, I have lots of lunches and coffees. And I love meeting new people, especially people that are doing interesting things for the right reasons. And I think this falls right into there. But another opportunity in Western New York that's happening next year that is once in a career is the fact that a lot of institutions are moving to a single electronic medical record. And it may not sound like it's much. It's called Epic. And ECMC, Kaleida Health, UBMD, we're all moving on to the same electronic medical record, which is an enormous investment, time, money, resources, people. So that will allow kind of all of that data to live in one spot. So now you take a program like Matters, a common electronic medical record with hundreds of thousands of emergency department visits a year, and an AI institute at UB that is continually growing and becoming more sophisticated. And now you'll be able to look across the city to see, okay, where's potential opportunities? Where are people getting care but only getting part of care? And you layer AI in the back of that, and the AI sits in the background and kind of watches for the right patient to come up and then puts that patient on a dashboard so then you can act on it. Wow. So I'm so excited.
That's fascinating.
Yeah, it is.
I mean, and I don't even know the full capabilities of AI, but I mean, that's just very basic knowledge, and we will be able to help people in ways we've never been able to in Western New York next year.
That's amazing.
That's huge, man. Congratulations on that. You've done so much in just a very short amount of time.
I mean,
even your team,
not
Josh.
Me,
that's everybody.
But it's really a unique opportunity in Buffalo. I think great things are going to happen in healthcare in 2026, despite the challenges that might be coming from the federal level.
Well, now I am curious because you're bringing this up because now I have a whole host of other questions. But are these hospitals literally are they capable of pulling this kind of a transition off? I'm thinking about ECMC, other Kaleida facilities, BuffGen, all of our facilities. They're kind of antiquated, as are their systems. Are they ready to do this?
I'll tell you, I mean, the teamwork that I've seen over the last year in preparation for this between ECMC, Kaleida, UB, and UBMD, the practice plans of UBMD, all the different disciplines, is incredible. It's incredible, and the level of cooperation like I've always kind of wished for in Buffalo.
Wow.
So I'll tell you, the last time I was this excited for healthcare in Buffalo was when I heard rumors that the GVI was going to be built, the medical school was coming downtown.
Wow.
I mean, this is huge. It's just not as, you can't show someone the building, right? It's just the behind the scenes and the technology integration is really, again, it's like once in a lifetime opportunity for Buffalo.
All right. Well, that's another interview opportunity for us as
Heck
well
yeah.
to talk more about that.
That is fascinating. Wow, man. Thank you so much for this,
Doctor,
Dr.
thank
Lynch.
you.
We
Thanks
really
for having
appreciate
me.
it.
Thank you for what you're doing for
Yeah.
those, dealing with substance abuse. It is a difficult issue for so many families in Western New York, and you're doing something that is actually helping. So thank you. Yeah.
Appreciate it, Dr. Lynch. All right. Thank you again for joining us here on Buffalo Brief. We'll see you next time.